and welcome to another exciting episode of your program of choice, Health Affair on AIT. I am your regular anchor, Ushuomowa Daniels. On the program, we'll focus on public health issues and the challenges of women and children with a view to finding lasting solutions. Today, our focus will be on the ongoing COVID-19 pandemic, other emerging infectious diseases, and how to prepare for the future against these biosecurity threats. Before we start the discussion, let's take you through our news segment.
The World Health Organization has kicked off the Decade of Action Global Plan for Road Safety in Geneva, Switzerland. The Decade of Action Global Plan, which is targeted at preventing at least 50% of road traffic deaths and injuries by 2030, also lays out the practical, evidence-based steps all countries and communities can take to save lives. The global plan outlines recommended actions drawn from proven and effective interventions, as well as the best practices for preventing road trauma. It will be used as a blueprint to inform and inspire national and local plans that are tailored to local context, available resources, and capacity. The plan is aimed not only at senior policymakers, but also other stakeholders who can influence road safety.
The West African College of Surgeons is a professional organization that promotes education, training, examination, and research in surgery in Africa. An organization that plays an important role of this nature ought to be getting support from various governments, but this has not been the case. The college depends on contributions from members and trainees to operate. It is in recognition of such members that this event of Monday, 1st November 2021 became necessary.
Okay, let us pray. All right. It's quite good. A little higher. Some are doing photo. That's allowed. Yes.
We are dedicating the Wall of Fame at the permanent secretariat of our college, the West African College of Surgeons. This secretariat, this edifice, was built completely with the contributions of the fellows and diplomates of the college. And having completed the building, we felt it was very important to equip it to the standard that's befitting of a college of our stature. And so we embarked on this additional fundraising drive. And those who have made significant contribution to this new effort are being honored today by having their names displayed permanently on the Wall of Fame at our secretariat.
Gold is 1 million naira, silver is 500,000 naira, and bronze is 250,000 naira. We are also encouraging others who may not be able to give up to that amount to make similar contributions, which will be recorded in our registry, and they will all be honored. So this is a fundraising activity to support our activities of training surgeons, not only for Nigeria, but the whole of West Africa. Our aim is to saturate the sub-region with surgeons. It takes a long time to train surgeons. It's expensive to train surgeons. Often the resources to train are lacking. And so we need to work with governments to provide the necessary facilities so that we can train our future surgeons.
We are also taking the opportunity to announce our presence to corporate organizations and to say that we're open to this type of venture in which they'll come to see a good work being done and then be part of it, assist the college in growing, and we shall also recognize them for the good work they do. So this was why the college, the president, and the council felt that this should be done today. And I'm particularly pleased that it was a big, big success. As we did say when we started the event today, we've not borrowed a penny from any source, and the fellows of the college have been on their own, have succeeded in doing all that they have done, but it's still not complete. And they are looking for every legitimate means in raising funds to continue to make the college what it should be. As you know, this is a college that is responsible for the training of surgeons and those in the surgical disciplines all through West Africa. So it's a very big commitment. It's a very big commitment, and therefore, it has to be properly done, and to be properly done, the infrastructure has to be present. And this is why we are continuing with this process of crying aloud to people to come to be associated with this great venture so that it can continue to prosper.
The event provided an opportunity for discussions about the challenges in the health sector, especially on training, brain drain, disease prevention, strengthening primary and secondary health facilities.
I think brain drain is so complex, but again, improving the working conditions of medical practitioners in country. Most people want to stay in their country. If they can have fantastic conditions of service, they will stay. Bottom line.
Addressing the issues of health promotion and prevention of diseases, we have not given it the desired attention. What is really needed to make sure that people do not fall ill, we have not done enough in that regard. And so because we have not done enough in health promotion and prevention of disease, hospitals and health centers are overburdened. So we need to relieve that burden by improving public health measures, and then we also need to strengthen those facilities, the tertiary hospitals, the secondary level hospitals, and the primary health centers that are expected to take care of majority of the health needs of our population. So all of those things have to be taken together to ensure that our population is as healthy as possible.
Of God and the benefit of all mankind. Council of Nigeria Lagos Zonal Office Building was commissioned by Dr. Osage E. Ehanire, MD, FWACS, Honorable Minister of Health, Federal Ministry of Health, Abuja, Nigeria, on Friday, October 29, 2021.
That was the commissioning of the newly constructed Lagos Zonal Office Building of the Pharmacists Council of Nigeria, PCN, on Friday, 29th of October 2021 at Edmond Crescent, Yaba, Lagos. For the registrar and other dignitaries present, the building will translate to improved service delivery.
This is the 9th facility that we are having, owned and built by the Pharmacists Council of Nigeria across the nation. And we're very happy. We are thankful to the National Assembly and the federal government for giving us the funds to build this building.
We look forward beyond all challenges and collectively believe that with the commissioning of the newly constructed Lagos Zonal Office, that by the special grace of God, this noble work, we shall reap the fruit.
Definitely it's going to improve service delivery because one, we have more space to accommodate more workers. You can see the old structure we have. When stakeholders come, some of them stand under the sun, and some, because of that, they are discouraged. But now you have a full complex that will accommodate about 38 offices or thereabout. And that will be able to accommodate people who come for services. They can sit there, relax, and attended to. Secondly, we have provision for library that will serve as a drug information center. And with that, we'll be able to communicate more effectively with the stakeholders.
The event provided an opportunity for discussions on interpersonal relationship among healthcare professionals, promotion of local manufacturing, and other critical issues in the sector.
One misconception that is going on now across the pharmaceutical landscape is that the pharmacist is moving from product-centered process activity to patient-centered activity. And because of that shift of emphasis on the patient from the former one, which is the product, that's the drug, is causing a lot of misunderstanding, misinterpretation. Some people are now thinking that as pharmacists are coming to a patient-centered practice, they want to take their job. No, it's not. It's not. And the pharmacist profession is the only profession that has two major components. It has the product component and the practice component. People think they can just open a patent medicine, open a place to sell drug. No. What impact is that drug having on the patient? And that is the shift of the pharmacy practice in the country. And that's the shift all over the world, that this is something you are holding on to. Do you know the impact of it on human? If you don't, then you should not handle those drugs. Do you get what I'm saying? And that shift from product-centered practice to patient-centered practice is what is causing some disconnect or confusion in the system. But we'll go out and explain to them that this time around it's not patient-focused that we are doing. This product we are producing, what impact is it having? And if you now understand that, people who are doing fake drug will now have to change their orientation.
Is the need for harmony and collaborations among professionals in the sector. We all serve one thing, and I said thing because we serve human being. It's the patient. It's only compartmentalized for that service to be delivered. No one of the members of the profession can achieve the objectives or the outcome expected without the collaboration.
How do we make that happen? Obviously, we need to identify who is the agency or the authority that really defines the scope of practice. The scope of practice for the physicians, the scope of practice for the pharmacists, for the nurses. I think that's number one. The scope of practice for the disciplines. And then once that's defined, then there needs to be an agency or entity to ensure compliance.
The question of local manufacturing is always key in our aspect because we inspect facilities where pharmaceutical manufacturing takes place. We have about 200 pharmaceutical manufacturing facilities in this country, and there are more. And certainly there are some challenges in respect of the importation of active pharmaceutical ingredients.
Do everything possible to strengthen our relevance to the healthcare by improving on the manufacturing sector and making sure that if in future things like the COVID-19 comes, Nigeria will not be left behind by way of, for example, the manufacture of vaccines.
The Pharmacists Council of Nigeria is a federal government agency of Nigeria established by Decree 91 of 1992. The agency is charged with the responsibility for regulating and controlling pharmacy education, practice and training in all aspects.
World Bank projections in January of 2021 indicate that the effect of COVID-19 pandemic will throw approximately 10.9 million Nigerian families into poverty by the year 2022. Barely 1 year after, the realities of the World Bank projections is already manifesting, given the high cost of food items, which has left several families in total hardship. Women at the Arise Conference, however, believe that they have what it takes to provide support for their families in the face of new challenges.
It's time for the women to push for revival, for sustainability, for poverty to be eradicated from the face of our nation. And how do we do that? Get more women to work. Get more women to participate in small and medium-scale industries, that our people would consume goods made locally within our shores.
We have the Nasima Women Business Group, who is a partner to us, Ministry of Women Affairs. So there are a whole lot of opportunities there and the kind of support that is available, and they can tap into those for them to sustain themselves and also expand and be part of the non-oil export and also part of the economic growth.
Living or staying alive has never been much appreciated as much as now. Despite that, you see the traumatic past experiences, we still have a God who can perfect, establish, and give us a time of refreshing.
God has done everything that He needs to do.
He has packaged every woman. So there's no reason for you to allow anything to die in your hand as a woman. If anything is done, you have the power with your tongue, with your mouth. You use your mouth to shape your life in the direction you want it to go.
Greatest asset any man can have on earth is a praying woman. So the role of women is more crucial than they think. With the statistics before me, if women are serious and determined, they can determine who rule Nigeria.
The conference, which had the backing of the Lagos State government for a vaccination center to be opened, provided another opportunity for Nigerians to access health care with the aim of addressing the health needs of the people.
It is only in prevention that we can ensure sustainability. If we continue to do curative, which I can't afford, you possibly can't afford, then we would have more people dying prematurely. I get vaccinated, you get vaccinated, then we can eliminate COVID. It's not only COVID. There are many things you can eliminate by preventive care.
We need to get vaccinated. And luckily for us, in this venue today, you can get vaccinated.
It's important to congratulate the convener. She's done very well to get, to this point, 13 years of every year doing this and being impactful.
If every one of us should continue and do the little we could to put succor in the lives of individuals, the world will be a better place to live in.
The hybrid conference, which is the 13th in its series, has thousands of participants in attendance from different parts of the world.
The transfer of authority to Mustafa Olajide Sikiru there as the 20th president of Ikeja Metro Lions Club for the next 1 year. Thereafter followed the installation of club officers, induction of new members, and fundraising toward humanitarian causes. While the new president intends to focus on all aspects of charity works in compliance with the mandate of Lions Club International, the health sector, especially cancer and diabetes, will be given a major attention.
Glory to Almighty God to be elected as the 20th president of Ikeja Metro Lions Club. So we intend to build an office space for the Nigeria Police in Area F Command, because we are able to engage with them and we realize that they need office space. After working under the bridge, under the sun, they always like to have a place where they will gather, to relax their brain. And we believe when we help our police, it's going to help the community. They'll be able to start their, duty as well. And last month, we carried out a vision we did in conjunction of the 404B to Nigerian Lions Club. We carried out over 1,000 cataract surgeries free of charge.
They have to maintain the momentum, sustain the momentum, and even build on it to surpass what he met on the ground. Service to the community is our first creed, because service is a way of life. So he has to improve on it. But in doing that, he has to sustain the momentum of members of this club.
It's been a very successful investiture and fundraising. We have our projects lined up from the childhood cancer, the environment, the diabetes, the relieving hunger. And so the money we are raising this year, we are targeting it under our health section. If I say under our health section, whatever amount we have realized today, we want to ensure that we'll go out there, identify those children who need our help, talking about the childhood cancer now, to support them and assist them. Then the diabetes people too, those who are diabetic. By the time we identify them, we'll also take care of them. These are the areas, these are where the funds that we're raising today will be channeled to.
When you say diabetes, you have to educate people. What's the meaning of diabetes? There are two major types of diabetes. Type 1, type 2. Our people don't know the difference. Sometimes they use the drug for type 2, for type 1. They have to know the difference so that they can handle these issues. You see, the level of illiteracy in our country is high. If you want to do anything humanitarian, you have to do a lot of explanation.
A lot of people who are, living and they don't know that they are diabetic. So we want to create awareness, we want to sensitize the public. We want to do a road show. We want to also conduct, screening for those who may not know that they have the, ailment, hiding in their body. So it's going to be a very, very, huge participation, and we encourage public-spirited Nigerians to also come and partner with us so that we can really, really make the desired impact.
District 404B2 has in the past 20 years championed the cause of better life for humanity through environmental protection, support for education, sensitization on diabetes mellitus, cataract surgeries, provision of water to communities, and lots more. Ikeja Metro Lions Club is the largest in District 404B2 Nigeria, with 89 members offering needed services to the immediate communities. As part of efforts to mitigate the further spread of the COVID-19 virus, the Governor of Lagos State, Babajide Sanwo-Olu, launched the statewide mass vaccination campaign. The campaign, which is targeted at ensuring that 4 million residents of the state are fully vaccinated before the end of the year, intends to further the quest to eliminate opportunities for COVID-19 virus spread in Lagos communities. The mass vaccination campaign, which commenced on Wednesday, 27th October 2021, will run till Saturday, December 25th, 2021. The governor noted that a total of 1.2 million individuals in the state have been vaccinated with the first dose of either AstraZeneca or Moderna, while those fully vaccinated amount to 550,000, accounting for about 4% of the target population. He also added that vaccination fixed posts across 205 public health primary centers, 14 secondary and tertiary hospitals, 400 private health centers to ensure the state meets its target of vaccinating about 30% of its population.
Professor Wale Soyinka, while narrating his ordeal during one of his international trips outside the country, said the requirement for Nigeria's COVID-19 guideline protocols for clearance has become too cumbersome. A development is said has caused pains to most travelers.
If there is COVID and it is necessary to lock down, I don't think any of us complains. We go with it because we know there's nothing anybody can do about it in the interest of the majority. But when an individual is prevented from getting entry into his own country through the lapses of others, then there is a problem. A few months ago, when trying to get back into this country, I reached, through France incidentally, I reached Charles de Gaulle Airport, had my boarding pass, and I was about to board the plane. At the very entrance to the plane, I was told I couldn't get on. I had my vaccination. I'd taken the 72-hour COVID test, and I was negative. But apparently there was one more. There was a new one called PCR. Is that correct? I don't even know these initials. Anyway, which the Nigerian government had begun to insist upon. Now, I was away from the country at the time. I didn't know this. I thought I was all geared up. I couldn't get on that plane. I had to go back into Paris. And the test, by then the offices had closed or whatever. Anyway, I spent 3 extra days in Paris before I could get back on. After taking the test and getting my result, 3 days. I did not complain. But it's happened a second time, just about a week ago. This time I had my PCR, or whatever it's called, and of course I still remained vaccinated, and exactly the same thing happened to me. And of course, it did not happen to me alone. There were other Nigerians who passed the night at the airport. They couldn't leave the airport because they'd already passed immigration. This time, it was not PCR or whatever it's called. It was that they had not gone to something called the Nigerian Travel Portal.
While acknowledging the relevance of COVID-19 clearance certificates, Professor Soyinka said the recently introduced online Nigeria travel portal, required to be filled as part of the requirements for travelers, is even more challenging, advising the Nigerian government on the need to adopt human intelligence as alternative when technology fails to ease the pains of travelers.
So nobody is saying don't take precautions, because the next thing they will say, well, the Soyinka said they should let everybody in and anybody at any time anyhow. No, nobody is saying you shouldn't take the necessary precautions. Other nations do it, but I don't believe that other nationals are, not humiliated is the wrong word, no, I just obstructed the way we are. I understand that some other West African countries have similar regulations. And so there's a plea to the Ministry of Health. It's not a pleasant sight to see your fellow Nigerians lying on couches. They can't go in, they can't go out, they're trapped in limbo. I think that's wrong. And so whoever is responsible for these funds should proceed to design something easier for humanity to fulfill, and also to have backup situations.
Some of the objectives of the Medical Laboratory Council of Nigeria include assessing compliance to minimum standards required for operating a medical laboratory facility in Nigeria, ensuring that medical laboratories generate accurate, reliable, and timely results for effective treatment and management of patients, among others.
It sealed 19 out of the 57 facilities. The team also closed 5 facilities and arrested 2 persons and will go on to prosecute one of the quacks. Now, the rationale for sealing is when that laboratory is operating in such a manner that poses risk to the public. Either it's being operated by non-qualified persons, or there are unwholesome practices that have a strenuous impact on the public.
The Deputy Registrar in an address said the Council is committed to minimum standards required for medical laboratory practice across the country in due compliance to World Health Organization standards.
Most labs in Nigeria are at star 0. So what the board has done is to make it mandatory that every lab in Nigeria, starting from July 1st, 2021, for it to be operational, must be operating at a minimum of star 1.
The need for more investment in preventive health care and regular health check has been re-emphasized by some experts. Speaking during a breast cancer awareness program in Lagos, organized by In Service of Humanity Foundation for Women of the Nigerian Police Force, they noted that late detection and presentation at the hospital accounts for the increasing number of cancer deaths in Nigeria.
When you have abnormal cells in the breast, then it is called breast cancer. And the reason these abnormal cells become a problem is that most times they don't just stay in that area. They decide that that breast is not just enough, and they would migrate to other parts of the body. So you hear of metastasis or spread. Everyone should get into the habit of having regular health checks. Don't go to the doctor only when you feel unwell.
Different clinics that have facility for cancer, they can either be a hospital, they might have an oncologist on call. Again, these are the questions that you need to ask, whether they have an oncologist in-house or they have an oncologist who is coming to see the patient. And some of the general hospitals have oncology units in Lagos State. And then you have the big hospitals like Lasuth and Luth that have good oncology units as well.
Issues of mental health care also came to the fore.
Abuse of substance can lead to PTSD. Why? Because this substance, they what? They, what is the word? Reorientate or disorganize our normal body chemistry.
The month for breast cancer awareness, so we picked this month to say, okay, let's use this to sensitize women in the police force.
In Service of Humanity Foundation is a registered health and welfare inclined non-governmental organization based in Lagos State, Nigeria.
Welcome back. Within the last few years, some African countries have experienced devastating effects of emerging infectious diseases like Ebola, Lassa fever, cholera, yellow fever, Marburg virus, and lots more. The world is currently battling with the COVID-19 pandemic that has claimed over 5 million lives. From predictions, COVID-19 will not be the last. Hence the need for the universal approach to address these biosecurity threats, as outlined by some keynote speakers at the just concluded 7th African Conference on One Health and Biosecurity Threats held in Lagos.
The threats are essentially in 4 parts. Climate change is a major factor, and the massive interconnectivity between countries. We know that deforestation and environmental degradation is causing massive rural migration to urban locations, and that's causing a continent described as a continent of megacities, and Lagos State, or Lagos, is an example of that. What is driving the emergence of infectious diseases in Africa? And you can see from this map that Africa is hot, which means that we are experiencing a large number of infectious diseases on an increasing basis. The ease and ability of people to move very quickly from one location to another, and people carry infectious diseases, and through this methodology, agents of concern are spread very quickly. The responsibility of government, basically, is to equip every country and every state with the ability to quickly detect, to bring to a quick halt a potential outbreak, and to do this, it requires to develop infrastructure, human resources, such that we can restore calm and avoid economic collapse as a result of these pandemics. There is a great need for nations to develop a biosecurity framework, and we're doing that at the moment across the West African region. We've already developed one in Lagos, and we're looking to work with the federal government to develop a national biosecurity framework.
That in our response to COVID-19, there are 2 areas that Africa is lacking behind, and those 2 areas are vaccination and the application of genomics technology to solve emerging issues like COVID. Most countries or most regions in the world have vaccinated 40, 50, 60% of their people, while Africa is still struggling to vaccinate 3% of the population of the continent. Can you imagine if COVID is as bad as Ebola, that you need to vaccinate within a very short period of time? That means Africa will be in a very terrible state. And with the rates or increase in frequency of these emerging infectious diseases, now we're having COVID or we're having Ebola happening almost every year in different parts of Africa. We can't afford to be behind the vaccination. We have to be ready for what is coming next. And that is why the issue of vaccination has become extremely important. Presently, Africa is only producing 1% of the vaccines that we're using on the continent. That means we're putting the health of this continent in the hands of others, and that is a big biosecurity threat on its own.
The WHO referred to this as disease X. So we don't know whether COVID is disease X. There will always be a new and emerging disease. So the most important thing is to put in place your structures. And they need to invest in research, because research provides evidence for policy, it provides evidence for decision making, and it provides evidence for developing interventions. So unless you invest in research, you will not be making any progress. You will have to then depend on other countries. Other countries have invested, they are not going to give you for free, or they are not going to give you cheap. If you look at the vaccine for COVID, for instance, some of the Western countries paid up front, even while the vaccine was still being developed. So it wasn't as if they paid after the vaccine was developed. So they paid up front, and what they paid was used in the research and development for the vaccine. And that was why, again, they demanded that they should have first choice in the supply of the vaccines.
The adapt is
first recognizing that there is a problem, because the first step in any cure is to recognize that there is a problem. Second is to recognize that we have capacity to do whatever we want in this continent. We do have capacity. We need to harness that capacity. So we need to build confidence in ourselves, stop depending on others, because others will never. Nobody can ever love you more than you love yourself. My people used to say that nobody cleans the cooking pots for a bachelor than the bachelor himself. So even if you go out there and come back, it's still there waiting for you. So Africa's problems need to be solved by Africans, just like it's done the whole world over. And the points I highlighted is recognition that Africa is not free. And if we recognize it and then struggle to get Africa free, that is the first thing. Then we have to recognize that we have capacity. Stop depending on others to do for us what we can do for ourselves. And then there's no leapfrogging. We cannot jump from 1 to 100. We have to go through these steps and learn. And then recognize there's what we say usually, that practice makes perfect. No developing country. Okay, and another thing is that it is clear that there cannot be no region of the world ever progresses without manufacturing. We renounce the dependency attitude. Africans love to have people do things for them. We have to renounce this, recognize that we are capable of doing that, struggle, because if we believing is achievement, we have to believe in ourselves, and then we move forward and do that.
We need to build more momentum to ensure that the gains we have made are not flickered away. So how do we do that? The way we do that is to continue the way we have started, planning ahead, changing policies when it needs to be changed, and then putting in data, important data, to inform our policy changes. And that is the way we've been moving in Lagos State. And we hope to continue that way. Then how do we continue that way? It means that we need a lot of resources to maintain that. We need the manpower, we need capacity. I think all we need to do is to be on our toes, continue to deepen the engagement in terms of addressing emerging infectious diseases and all other health challenges, because emerging diseases is just one part of it, but we can see what emerging diseases, infectious diseases can do in terms of what have happened concerning the pandemic. So it means that we must always keep our eyes on infectious diseases, and as much as we also look at other health challenges in our community.
If you are just joining us, it's Etafe on AIT. Next on the program is our nutrition segment.
Scent leaf, commonly known as clove basil in English and efirin in Yoruba, is a strong aromatic herb native to Nigeria, Ghana, and some parts of Africa and Asia. It is found in farms, gardens, and mainly used as a spice for cooking delicacies due to its aromatic taste. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella, and Candida albicans. It is also a repellent against houseflies, mosquitoes, and other insects. As a vegetable seasoning, it gives every meal a delightful, unique, and sweet taste. From research findings, there are numerous health benefits from scent leaf. Scent leaf aids digestion. It helps bowel evacuation and weight management. It can be used to treat oral infections as it kills all bacteria in the mouth which cause tooth decay and bad breath. Scent leaf is used in the treatment of fever, cold, catarrh, as well as skin infections like ringworm. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella enteritis. Extracts from scent leaf has also been reported to lower blood pressure, blood sugar, and potent for the treatment of gastroenteritis and lots more. Scent leaf can be taken as a tonic. It can be taken like salad or added to dishes during cooking.
You know, it is always said that our health is in our hands. And if we take it literally, you see that these our hands can do quite a lot of things. But when you also look at it in terms of bacteria, you see that it traps a lot of bacteria. So, as much as possible, it's important that we wash our hands. All of us, everybody now understands that we need to wash our hands. But you see that there are different ways people wash their hands. If you wash your hand well, then you'll be handling this issue of taking out bacteria from your hand, and it will not enter your mouth or your eyes or other open places in your body. So now I'm going to demonstrate hand washing. But first of all, let me show you what some people do. They will just do things like this. They have washed hand. That is social hand washing. Sometimes people just do things like this. They have washed their hands, but then they have not completely washed their hands. So we need to give a little attention to the way we wash our hands so that it will benefit us. First of all, you try to wet your hand, just to put some water, then you take the soap. When you take the soap, you put palm to palm and you rub that soap. You can even do it, 5 times. Just 1, 2, 3, 4, 5. Then you do the 1, 2, 3, 4. This under 1 minute, you have finished doing this. Then you make sure that all these places that trap, bacteria, they are taken care of in between your hands and the back of your hands. You see that sometimes, even all these ones, you see there's not much water because water has not touched this back of it. So when you're watching, you take and pay attention to it. So 1, 2, 3, 4, 5. Then you do this 5, 4, 5. Then you wash. These are places where bacteria trap. Then you wash the tip of the fingers. And ensure that every other thing that traps, then you rinse off. You can leave it to air dry, or you use a disposable if you have to clean your hand, and that is it. Your hand is clean. What doing is really what doing well. And you see, this did not take us up to 20 seconds. I've finished.
We welcome your contributions on how to improve the nation's health sector and human lives on our perception segment.
Well, I don't think people should be forced to vaccinate. Rather, they should be they should be told the reasons why they should vaccinate. Because it's also their right to say they don't want to, even though it's a public nuisance. If you don't get yourself vaccinated, it means others will be at risk if you are infected. So it's something the government can provide enough information, communication, talk to the community people about their rights and the need for them to vaccinate. There are a lot of misconception about what the vaccine is doing. There's a lot of conspiracy theories all over about the vaccine. But our people should know. I think the government need to show people that have died as a result of. They need to, until it gets to them. They are seeing what is happening in India and some other countries. So they should bring it up as a way of educating the people as to the need why they should vaccinate.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please, let's do it again, same time next week. Kindly support the program by advertising your health products and services. We'll do it for you at a very subsidized rate. My name is Ushuomowa. Daniels. Please keep staying safe.